Most patients do not report experiencing any significant discomfort after the procedure. Most of my patients take acetaminophen or Tylenol, and if they need something a little bit stronger, we may provide that to them if necessary. After the procedure, I ask that you apply ice to the area. You can use a frozen bag of peas or soft athletic ice packs, as well as apply compression underwear. Wearing supportive underwear will also reduce some of the discomfort that may be present after the procedure. Your incision will be rather small. There are going to be sutures underneath, which dissolve on their own, and I apply some skin glue on top to prevent moisture and dirt from getting into it. I ask that you do not get into a hot tub or a hot bath while the glue is present. The glue will peel off on its own, and other than that, you do not need to take care of the incision in any other way. I typically ask you to pull down on your pump about 1 to 2 weeks after the procedure and as you feel comfortable. Usually by the time you present to my office, which is usually 3 to 4 weeks after, you should be very comfortable pulling on the pump yourself. Most of my patients take Tylenol or ibuprofen after the procedure. Therefore, narcotic-induced constipation is not a common problem for us. I ask that you do not lift anything heavier than 8 to 10 pounds, which is a gallon of milk, for about 2 to 3 weeks. I also ask that you do not soak in a bath or get into a hot tub, as you will have some skin glue on your incision, and after this incision has healed completely, you can return to all of those activities again. Most patients typically return to driving and doing their normal daily activities after about 2 to 3 days after the procedure. You can also return to work once you feel comfortable and are not taking any narcotic medications. The typical recovery after the procedure involves simply doing some light lifting, after which you can return to your normal activities. Most patients are able to drive, go to work, go grocery shopping, simply a couple days after the procedure. If you experience pain that's out of proportion to the procedure that we performed, or start experiencing signs of infection like a fever, then you should call our office for further instructions. Your discharge papers after the procedure has been performed will contain your follow-up appointment date and time, and therefore you do not have to worry about needing to call our office to schedule anything right after. After about 3 to 4 weeks, you will come to our office for your follow-up, at which point I will examine you, and if appropriate, I will start teaching you how to use your device. If you have any questions at all, feel free to call our office. We have dedicated nurses, as well as myself or my PA, who can answer all of your questions.